Hello everyone. Once again, you are welcome to our MRSOG 3 Made Easy. And as I already told you that we'll be discussing two cases in each module. So today now we are going to discuss about the oncology module. Oncology module is a lengthy module once again. Like maternal medicine and subfertility, it's a lengthy module, and there are in the other aspects like information gathering, communication with the patient, family, and communication with the colleagues. So just all these things are there: patient safety, applied clinical knowledge. But in information gathering, as in any other case, history, investigations, interpret them, and then coming to the communication with the patient and family, it's very important. Because this is a cancer oncology we deal with the cancers. So, and we need to tell them about the suspected diagnosis in a sympathetic, in a sensitive way, very sensitive way. And so you have to tell about the when you communicate with the patient, we need to tell about the suspected diagnosis, what investigations have been done, and what investigations we are going to do, and give the management options, always options, and then we refer them to the oncology. So these are the things which we have to tell them, and also the care, the Macmillan care, and then breaking bad news. It is very important in oncology. Breaking bad news, we need to tell them very sensitively and provide support, psychological support. So breaking bad news and psychological support, it's very important. Now, communication with the colleagues and multidisciplinary team is very important. It comes in every station, almost every station in these malignancies. Now, you have to know about the pathway for cancer care in UK. So you need to understand this pathway for cancer care, and also you need to know about the patient safety. What you need to know, that is, you know about the treatment referral pathway. You have to know referral pathway, and then the patients, coming to the patient safety, you have to know about the prescribe when you prescribe chemotherapeutic agents. You need to know, tell them, you need to know also, then only you can tell the patient about the risk and benefits. So then applied clinical knowledge, try to draw a diagram, and always you have to say evidence based, you have to give them explanation, and always don't hide the facts, don't hide. Even if it's cancer, you have to tell them that it is cancer, and how we are going to help her, and how we are going to manage, and what is the survival rate is very important. And you can say that people are there like her, support groups like her, there are people who live long life, and with advanced treatment, we have the treatment for the cancers also, what is the prognosis, and the counseling, of course, I told you, and follow up. You have to always tell briefly about the follow up. So with this introduction, we may move on to the case which today, in oncology, we thought we will discuss about the endometrial hyperplasia with Atypia, which is very commonly asked. And the other case is, so this is one case, and the other case is cancer cervix. That is the next case which I am going to discuss in pregnancy. So it is also equally important. So now, coming to this case, endometrial hyperplasia with atypia, usually they ask with the subfertility. They come with the subfertility. If it is an endometrial hyperplasia in a menopausal age, when they don't desire fertility, its treatment is straightforward. But here, because she wants fertility, she wants to preserve the uterus, then the treatment options come. So, you're an ST5 in gynecology clinic today. Your next patient is Mrs. Rebecca Matthew, 35 years, who present with erratic vaginal bleeding. They usually come with erratic vaginal bleeding. In her previous consultation, she has come. She has come to discuss her tissue sample report a couple of weeks before, and she is planning pregnancy. This tissue sampling has been taken in the previous consultation. So today she has come to discuss that report, which is ready, and she is planning pregnancy. Her BMI is 34. Then her LMP 6 weeks before. And that is a few investigations are enclosed here. You have to check her, confirm her name, age, and NHS number, see whether it's same name or not. And histopathology report shows endometrial hyperplasia with atypia. And blood investigations, hemoglobin 9.5, and on the lower side, progesterone they have given. That is day 21, it is 3. Day 20 nanogram per ml, day 28. Usually we repeat. If it is an irregular cycle, we repeat weekly starting from the day 21. So 28, it is 4, and day 35, it is 2 nanogram per ml. You need to know what is the normal ovulatory value. So normal, it is more than 10. From this value, you know it's anovulating. And then estradiol, it is 1500 picomole per liter. And then beta SH also is given because she is 6 weeks amenorrhea. LMP. That's why we always do. Whenever she misses the period, delayed period, we always do. even if it's irregular periods. So it is 5. That means it is negative rubella. Rubella immune. So these are the why rubella, because she's planning pregnancy. Now from these investigation, when you look at it, you know she's planning pregnancy. She's 35. Her BMI is on that higher side, and then she has endometrial hyperplasia with atypia, and then her LMP is 6, so beta is negative. You have ruled out pregnancy. Her hemoglobin is on lower side. Progesterone is showing anovulatory status, and also estradiol is showing high. That means she is in hyperestrogenic state. Now you have to take the targeted history, explain the results, and answer her concerns. Make a management plan her. Now, so here I'm going to start the station like this, as usual, like in any other case. Introduction, then agenda, information gathering. Now, hello, I am Dr. Manjula, one of the doctors in the gynecology clinic. May I confirm your name and age, please? Doctor, I am Mrs. Rebecca Matthew. I'm 35 years. How may I address you? You can call me Rebecca, doctor. So this is the introduction. Well, Rebecca, I can see that no agenda. I can see that you have done some blood. You have done some blood test and also tissue sample you have done, and you are here to discuss about them. Am I correct? Isn't it? Yes, she says yes. Because that is she came to discuss, that is there in the station. So take the same word. So now, I also always take same words from the case scenario because they want you to talk about those things. Now, I also gather from your notes that you have some erratic bleeding and also you are planning pregnancy. Planning pregnancy is very important. Now, am I right? Yes. I shall address, see Rebecca, I shall address all your concerns. But before that, can I get a few details from you which helps us to make a management plan? Yes, doctor. Can you tell me more about your concern? Wow. So then now the information gathering starts. Now she says that is sorry, doctor. So that is what we want to know. What is the reason? I would like to know what is the reason for doing this. Can you tell me what is the reason for doing this sampling from your lining of the womb? And so she says, Doctor, now she starts. It's an open question. You want to know the reason why they have done, and then she will, at the same time, she will be explaining her concern also. So now she'll say, Doctor, I have irregular bleeding from down below. Then since how long? Since few months. And how is the bleeding? Like the amount? Doctor, it is and it is a moderate. It's not too heavy and not too light also, doctor. When did you notice? Usually during periods? No, doctor, during periods and also between periods also. I'm noticing it is coming on and off, and it comes and goes irregularly, doctor. So since how many days it lasts? Whenever you see, it lasts 1 or 2 days. And do you feel any pain along with the bleeding? No, doctor, no pain. Any loss of weight? She said, no, doctor, I did not notice any loss of weight. Any loss of appetite? Do you feel tired? And because these are the things which you are asking in every oncology case station, you have to ask these things. Loss of weight, loss of appetite, any feeling tired? Tired because she is anemic also. So she'll say sometimes I'm feeling tired, doctor, because she can be because of anemia. Now, can I ask you? This is about her. You have asked about the bleeding. You have asked about the pain also. Do you have any problem with the bowel or bladder? Any issues with the bowel or bladder? No, doctor, I don't have. Now, so then you can say, have you taken any treatment now for this bleeding? Have you taken any treatment? Have you consulted anyone? Have you taken any treatment? This is about the bleeding. I also see that you have some, you're planning to have a baby, isn't it? Yes, doctor. Since how long are you in this relationship? Since how long? And since how long you're planning? Since how long you're trying to have a baby? How long you're planning? She will say maybe 6 months. Doctor, 6 months. Yes. And can you tell me? Any treatment has been taken? Have you taken any treatment? Have you consulted anyone? Have you taken any treatment for this to have a baby? She will say yes or no. Sometimes she will say she has taken treatment, some ovulation inducing agent. Sometimes she will say, or she will say some herbal treatment. Then now you come to the sexual history. Then you say, because sexual history is important because she is planning pregnancy. We want to know whether she has any issues with this. So now, Rebecca, can I ask a few personal questions? Always signpost. As you are trying for a baby, can you tell me how frequently you have the intercourse? So, doctor, 2 to 3 times in a week. That is which normal. Any issues with you or your partner when you have the intercourse, any issues? That means you want to know that whether she has any problem like vaginismus or dyspareunia, and any pain. Do you have any pain or any bleeding when you have when you have the sexual activity? Anything? She will say usually postcoital bleeding will be there. She said, yes, doctor. Whenever I have a sexual activity, I have this bleeding. Then how about your partner? Does he face any problem? Any like problem with the erection or any the ejaculation? Any problem? So no, doctor. He's fine. He's fit and healthy. And then can you tell me whether any time you had any infection, that is sexually shared infection, like any pain in the tummy or discharge with smell or any fever? You and then no, doctor, I had nothing like that. And how about your partner? Whether he had any infection before, like pain or fever? Yeah, no, doctor. Suppose they say yes, then you say, have you taken any treatment for that? For these infections, have you taken? Okay. Now, any test has been done for your partner? Because sometimes we do the male evaluation also. She says yes or no. If yes, you can see the reports. If no, then that's it. Now, this is about the present history of present illness, such as history of present illness, and also the sexual history. Now, coming to the gynec history, are you regular with your cervical screening? Yeah, yeah, and she will say, yes, doctor, yes, I'm regular. And then, how about the normal or not? Then contraception, have you used any contraception before? Now she's planning pregnancy, but before that, you want to know. Yes or no, she will say. Then any previously were you diagnosed by a condition called polycystic ovary? Anytime were you diagnosed? Because this is an endometrial hyperplasia, the background mostly will be polycystic ovary. Were you anytime told that you have this condition called polycystic ovary? Yes or no, she will say. And she is obese also, weight is on the higher side. Sometimes she may say yes. Then, any previous pregnancies? Then she will say, no, doctor, I'm just trying only. Then now you're moving on to the medical history. Do you have any increase in the blood pressure? Are you on a long-term medication for any increase in the blood pressure or increase in the sugars? Or any clots? Have you any time had any clots? Blood pressure and sugar, they are more common in the polycystic ovary. Then you want to, have you taken any treatment for any other condition like any cancer? Have you had any cancer for the cancer of breast? Have you taken any treatment for that? No, then she will say no, because sometimes tamoxifen, suppose she says yes, then you will say, what type of treatment have you taken? Can I see your notes? So because tamoxifen will produce this endometrial hyperplasia, you want to rule out that. Then, any allergies? Always important. Any allergies? Have you undergone any? Have you any allergies? And what is your blood group? Why? Because blood group, sometimes you may have to plan surgery in that way. Any operations have you undergone in the past? Any family history of any concern, like increase in the blood pressure, increase in sugar, or any clots in the family? Cancers is important. In this endometrial hyperplasia, you have to all the oncology. You have to ask cancer. In the family. Only thing is cancer cervix will not have family history of cancer, but all others will have. That is any. You have any family? Anyone has any cancer of the bowel or any womb or ovary? She will say yes or no. Sometimes they will give in that station that her sister or brother had some cancer. They may give that also. So then, do you smoke? Take alcohol? And pardon me for asking, drugs? If they say yes, refer them to the particular center, which I already told you in the previous stations. Refer them to the smoking cessation center and de-addiction center, whatever is there. I see that your BMI is 34. It is slightly on the higher side, Rebecca. Were you told about, and were you told about this? That you have BMI is high? No, no, doctor. Have you done any? If suppose she says yes, have you consulted any dietitian or exercise program? Are you into the exercise program? You say that. Suppose she says no, doctor, I did not consult anyone. Then in that case, you say high BMI is not good for health. So especially for this condition which you are facing. So now, if you permit, I will refer you to the diet and exercise program, Rebecca, because that is very important for you to lose weight. It's very important. Now, I see that. So that is why. Then that is over. Now, what do you do for living? Then she will say she is working or not working or housewife. What she will say. How is the support at home? Now, because she when she comes to know this condition, she may be upset. That's why she needs support. How is support at home? Do you feel down or depressed anytime? Because of this, she's trying for pregnancy. That can also cause her depression. And any, so if she says yes, shall we arrange some counseling for you? Shall we arrange? Yes or no, she will say. Now, this is about the information gathering. Now, you need to know, would you like to add anything? So, no, doctor, or yes, doctor. So, now, examination. Examination, if suppose we need to do the examination because she is having erratic bleeding, we need to know because examination findings are not given here. So, in the presence of chaperone, can I examine you in the presence of chaperone? I would like to check you. We have to tell them why we are doing the examination. We want to check, my nurse will check your blood pressure and blood pressure and then pulse rate, and we will check urine also, and for this sugars, and then because she's prone for this diabetes hepatitis if she's polycystic, then I'll examine your tummy, and also already I told her in the presence of chaperone, and I'll examine down below to see whether how the bleeding is, from where the bleeding is coming, and how the neck of the womb is. I would like to know. Can I proceed? Yes. Okay. Now coming, so that is examination is over. Thank you, Rebecca. Now coming to let me explain to you a condition. I shall address all your concerns, and I'll explain to you about your management of your problem which you're facing, and also I will give a plan for your pregnancy. So I have seen your blood reports which are attached here. I confirmed your name, age, and NHS number on all the reports. Then so they belong to you. Now the blood test shows that your HB, that is blood strength, is on the lower side. So we can give you some iron tablets, so that will become normal, and that may be the reason for your tiredness. And second thing is this hormone what we have tested, that is on the 3 times we have tested, and that is on day 21, day 28, and 35. So this shows that to check, this we have done, they have done to know whether you're ovulating or not. It shows that you are not ovulating. That means eggs are not getting released from the ovary. So that is one thing we know from this hormone. And third thing is another hormone they have checked, that is called estrogen. That is that is estradiol. So it is more than the normal. That is, it is showing 1500 picomoles. It is showing more than normal, and we need to know from where this hormone is coming. So I will I'll discuss with you. Then the other thing is, because you said your periods are 2 weeks before been delayed by that is by delayed by 2 weeks. They have done the pregnancy hormone, and that came as negative. You're not pregnant. That means now, so the rubella status immune. So the other thing the coming to the tissue biopsy report. Rebecca, I see you now. BBM. Now BBM comes. I see that you're alone here today. Would you like to call someone to be with you? Why, doctor? What happened? No, I have an important information to explain to you. So can you? I mean, would you like to call anyone? No, doctor. No problem. You continue. So that's a BBN. Some BBN. Whether she want. Usually she says no. No, she doesn't want. She's alone. Nobody. She doesn't require anyone. So now, I say I do not have a good news to tell you. So shall I proceed? Then she will say yes. So now about the tissue biopsy report, you say that so now coming to the reports what I mentioned, I'm going to explain to you. I'll draw a diagram and show you. Now here, before going to that, I want to tell you that one hormone which is very high, we need to know from where this hormone is coming. Have you taken any treatment? Suppose she has taken, she will say in the information gathering only. So you told me that you have taken some treatment for to have a baby. She may say that she has taken herbal treatment or any ovulation inducing agents. So if she says, now you say, you have told me that you have taken some treatment for to have a baby. I feel because of that it could be the reason that this hormone is very high. So you need to stop those medications. And second thing is, we would like to see. I will arrange a scan for you. We will arrange a scan. So first you told them to stop all the treatment. Now the second thing is, hormone is high. It could be reason coming from some mass coming from the ovary. So that is, we will arrange a scan for you to see whether your ovary are having any tumor growth in that ovaries. So this is the second thing you have to say. So, for the higher estrogen values, you are ruling out a fertility treatment. And second thing is, you are ruling out ovarian cancer. So, you told her. Now, this I'm drawing and show. Let me draw and show your tissue sample report. This is the womb. This is the lining of the womb. And this lining of the womb has been thickened. And because it is thickened, because it could be some because of some abnormal cells. So because that is why it is usually what happens, this lining of the womb will shed regularly during periods. Usually it will shed regularly, but and it usually normal thickness, but here because it is more than thickness is more, they have taken and a tissue sample for that. And second, you have, or you already presented with typical some irregular bleeding, so that is why they suspected normality and they have taken the tissue sample. So, and they have sent it for testing to check under microscope, and the report has come. So, so shall am I clear so far? Yes, doctor. Shall I continue? Yes, yes, doctor. So now what happened, doctor? Tell me. Because she doesn't know the report, you have to ask, did anyone explain to you the report? No, doctor, no one explained. So now that is why it is baby and station. So now here, the cells usually not what happened, normal cells are round and the regular. You draw and show. But whenever, then whenever it is abnormal, that means whenever it is not normal, it is becoming abnormal. The cells become irregular in shape and size. So that and also it causes irregular bleeding. So that is so this can happen. This the possibility. So they could be just let me tell you, 4 out of 10 they could in such cases 4 out of 10 women may have cancer in the womb. We are not sure, they may have. So we are worried. So we have to do further tests for you. We have to do more tests for you to make sure that your womb does not have any cancer. So we make. So shall I continue to explain? Yes, yes, doctor. Then what are you going to do? What is the treatment for it? Yes, I am coming to that, Rebecca. See, let me tell you. First of all, we will give tablets. Your care will be under a team of doctors. That is called multidisciplinary team, where we have the consultant, our consultant, then our our consultant gynecologist, our cancer specialist. If required, we will call him, and then imaging doctor, the imaging doctor also, because sometimes we may have to do MRI also, the imaging doctor, the lab doctor, and also specialist nurse, senior nurse. So then we'll give you tablets for to get the periods. First of all, we'll give you the tablets to get your. Then second thing is we do a camera test. So we do a camera. Before that, we will do some blood investigations. That is. And then we do some investigation which are required, and also we'll do a camera test. We'll put you to sleep. It is done under sleep, and we put a camera, pass a small telescope into the womb and take a small piece from that, look everything inside the womb and take a small piece from it. And then this test will be sent for testing to check whether other area of the womb is clear. So this is one thing we will do. The second thing is we will do some special imaging, that is we call MRI, so that to know whether there is any problem in other organs, any other areas, whether any abnormality is there. The third thing is we will send some blood tests. We'll do some blood tests to check for the tumor proteins, to check whether there's any abnormality. That is by doing some tumor protein markers. That's called protein tumor markers. So am I clear so far? Yes. Now what we do after this, now when the report comes, that after seeing the report, we will discuss the management for you. Now, the management usually what happens, because if the woman completes her family, there are two. One is removal of the womb. Second thing is keeping the womb. So because you're pregnant, you're planning to have babies, womb is not removed. Otherwise, if the family is complete, if the woman has completed the family, usually we remove the womb. But in your case, because you are not, want to plan pregnancy, we will not remove the womb. So what we will do, then what you are going to do, doctor, how you are going to manage? Yes, so we have another option, that is hormone treatment. We give you hormones called progesterone. Then that progesterone can be given as a coil, that is a hormone coil, and it can be given as a tablet. So two forms are there. So coming to the hormone coil, I shall explain to you both. that is hormone coil. This hormone coil, as is inserted, is put into the womb from down below, and it is kept inside and left. It is left there only. And so what happens? It slowly acts and it thins out the womb lining of the womb, which is very thickened. It causes thinning of the womb. It will it convert the abnormal cells into normal cells. So that's way your treatment, your problem will be cured. So it changes all the abnormal cells to normal. Am I clear? So yes, doctor. So this is the first line. This is the preferred treatment. This is the best treatment. And but doctor, is there any other? Can you tell me about other option also? So because I would like to make a choice. Yes, there is other option also. If suppose a woman is not willing for the coil, copper coil, if she is not willing, we have tablets also. So the tablets also need to be taken continuously. So this, till we tell you, it has to be taken continuously. So then to know whether your cells became normal or not, the lining became normal or not, we take a tissue sample once again, Rebecca, after 3 months. After 3 months, either after hormone coil or after tablets, we will take a sample and see whether abnormal cells are there or not. So once it is normal, once it becomes negative, we have to get, and we'll repeat again after 3 months. So we need 2 negative tests. Am I clear? Yes, doctor. So we need 2 negative biopsies. Now, once it becomes negative, we will put you in touch with the fertility specialist because you're planning pregnancy. Okay. Why, doctor? Fertility specialist? I can conceive, I can become pregnant normally only, no? Yes, you can become normal, but because it is and because it is not advisable to wait for long, because for natural pregnancy to take, it may take time, and it is advisable not to wait too long. We advise you to become pregnant as early as possible. That is why we want to send you to the fertility specialist who may help you to have a baby through a test tube, through latest technique called test tube baby, that is IVF. Am I clear so far? Yes, doctor. Because you have to become pregnant as soon as possible, because this condition can come again later. So with this, once you conceive with the test tube baby, because that with the test tube baby, the chance of having baby also is very high. That's why we prefer to have a baby with the help of the doctors. So, am I clear? Yes. And second thing, so now once you complete your family, once you complete your family, what we do, we will remove the womb. Once you complete the family, the other thing is, when the womb will be removed in some other conditions also. I need to tell you, Rebecca, when you are not responding to this medicine, this hormone, when there is no response to this hormone, or you responded initially but it came back, it comes back, then also we may advise you to go for major operation, that is removal of the womb along with the ovaries. So this we do if there is no response or if the disease comes back. So then and other thing is when you complete the family. Am I clear so far? Yes. Now, the other options can be, you can go for the other option I need to tell you, that's called surrogacy, where your baby will be carried by another woman who will carry the baby, but with your ex and who is with the baby is formed with your ex and with your partner's sperms only. But she will be carrying the baby with her consent. We can go that we can choose that. So now after that, that is called surrogacy, and after the delivery of the baby will be legally yours, and genetically baby is yours. The other option is adoption. So these are the options which are there, which I explained. So now you can discuss with your partner. You discuss with and you take a decision, and whatever you decide, it will be respected. Am I clear, Rebecca? Yes, yes, doctor. The other thing is, I want to tell you, apart from this treatment for this condition, you need to do some lifestyle modifications. That is because I told you that BMI is higher on the higher side. So I'll connect you to the diet and exercise program. You need to reduce the weight because it is not good for this condition. So that way. So now, anything else? Do you have any other surgery and any other doubts? Do you have any other concern? No, doctor. So now I will, this is the information leaflet, and that is about what the condition, this condition, what we have discussed. Now I will connect you to the support group who face the same condition problem. You can discuss with them. and I'll give the tablets. I'll prescribe the tablet for you. Then you can take this prescription and take this medicine for the periods to come. Then I'll give an appointment with my consultant, and so you discuss with your partner and come down and tell your decision. So about the treatment, then we will go ahead with your treatment. Now, so then suppose then if you need any counseling, then we will arrange a counseling also. And other thing is I already told you diet and exercise program. So okay, now then if suppose she's referred here, she's not referred by GP. So if it is this is for you, I'm telling. If she's not referred, then we'll write back to GP. Okay, so now if she says no doctor, if everything is clear, that's all. This is a closure. So you can say thank you for opening up, thank you for our discussion. Okay.